Every time healthcare reform comes up for discussion, I see people arguing about whether a publicly or privately funded system would be better. The Affordable Care Act, in an attempt to forestall this debate, decided to split the baby and give half of its newly insured beneficiaries public insurance, or Medicaid, and half private insurance through the insurance exchanges. But that's not really true. This is Healthcare Triage News. Yes, the half of people getting expanded Medicaid are getting public insurance, but the vast majority of people getting private insurance are also getting public funds with subsidies in order to purchase their private insurance. In other words, even though we expanded private insurance, we're doing it with taxpayer dollars. Overall, the reduction in the uninsured was due to mostly public spending, with relatively little private spending overall. This isn't rare in the U.S. healthcare system. A recently released policy brief from the UCLA Center for Health Policy Research entitled "Public Funds Account for Over 70% of Healthcare Spending in California" explains this quite well. If you just look at a simple analysis of Medicare, Medicaid, and CHIP, you might find that about 45%, or less than half, of total U.S. healthcare spending is public. But that ignores a ton of healthcare spending that's also paid for with public funds outside those programs. In an effort to document the difference, researchers looked at healthcare spending in California. They included 4 major public funding categories: payments for public health insurance programs like Medicare and Medicaid, government payments for health insurance coverage for public employees, like me at Indiana University, for instance, tax subsidies for employer-sponsored insurance and those purchasing exchange plans who are in less than 400% of the poverty line, and county health care expenditures. Everyone accounts for number 1 in their analyses. Most people also account for number 4. Too many people ignore number 3, though. The tax expenditures for employer-sponsored health insurance are massive in the United States, and the exchange subsidies aren't cheap either. And almost everyone ignores number 2. All of the people who work for the government, who work for public schools or the police department and all those kinds of things all get private insurance, but you, the taxpayers, are paying for it. People like me. I'm grateful to you, by the way, but I'm on the public dole as much as anyone else in this respect. In California, healthcare expenditures in 2016 are estimated to be more than $367 billion. That's one state. Let that sink in for a minute. But much of that is public health expenditures. About 27% are from Medi-Cal or Healthy Families. About 20% is Medicare. The tax expenditures for employer-sponsored private health insurance are 12% though. Public spending for private insurance is 4%. County health expenditures are 3%. ACA exchange subsidies are about 2%, and other government programs are about 3%. Add all that up, and public health expenditures in California are almost $261 billion, or about 71% of all healthcare spending. What's left for private? About 16% of spending is employer shares of premiums, 6% is employee shares of premiums, 4% are out-of-pocket spending for covered benefits, and 3% are premiums for individually purchased plans. Some caveats. California spends a bit more on public funds than the rest of the country. Their Medicaid expenditures are a bit higher, as their 33% of the state being on Medicaid is higher than the national average. They also have a bit more in tax expenditures for employer-sponsored private health insurance than the national average. The national average for public share of healthcare spending is still 65%, even if it's not the 71% they have. Even that might give you some pause. Even nationally, more than 2/3 of healthcare spending is being done by taxpayers through public funds. We may have a private health insurance system, but much, much more of it is being paid for by public funds than many think.
Healthcare Triage is supported in part by viewers like you through patreon.com, a voluntary subscription service that allows you to support the show through your monthly donation. We'd like to thank our research associates Joe Sevitz and Karen Green, and our Surgeon Admiral, Sam. Thanks, Joe and Karen. Thanks, Sam. More information can be found at patreon.com/healthcaretriage.